nim ene wonam da bia efise ne wakoma air prehwehwe ne wo tempenten kwa epe nyina no se wuti nyame anim if the presence of God goes with you asane ma ne nyina ehye ho no mu bi eno na nam so ma Moses ka say Awurade wanim ne me ankwa a mintimi nko efise ne wokoye nyina no Awurade anim na ebetimi aye nyame nhira wo so afidie eda so da Kessben TV Kessben 92.9 and afi Kessben 93.3 FM. Midin de adwachewa wapomuden ho nsem na me ne wo ba bedi ho nkomo. Abusafo last week no ye hia mu ye di nkomo efa ya pomuden ho nsem ho. Ye hwe yade ahodo a ya na eyiye yen ye harawa efa ye minimu ba besi ya harawa mu na ma ya home aye basa last week na me hu say wote wona se nansa bia unya cold a ene se bia bibi kwara kwa je se unipadua no enema bi nkoyie immune system no enye strong da bia ye ba esua ade foforo ene ya sai babio ye sai aba besua ade foforo balm of Gilead vinegar edisika be so yasene ena kwasi ada wie ni kwasi ada wie bia itimi betena se edi stay healthy dwumadie ebrel sanso na multi credit savings and loans limited enso disika be so yasene ema yetimi di dwumadie ebrel wo mrepam no sa enyumakue meka omo ho asem edi akyerɛw ama wo hu ne ma pa ubenya de afiri wo omo ho ne enti esese o support omo product and services said de be ya da bia ombenya ska edi abeso yasene ni abetena se edi wapomuden ho nkomo abrel wo nano 3rd of February na World Cancer Day kokram ye ba ni enya nhase na me ka che doctor say se me kwa ya resabi e fre baby oncology doctor we chem ni enti e fre oncology na na se enko ho nso no because me ko ho a na me ye ma hye oncology enye baby a ye ko ho e fre ho oncology se wo ko ho a na aye wo adwendwen ene enema bebre yesi na ye World Cancer Day da na mpanyimfo nyina ayi ato ho no mu a ye de bokokram ho dawro last week na wo se ye ne doctor di nkomo na enso ye nya no nyame adom ene doctor aba enu nti ye bedi cancer generally enye cancer ba akopɛ na mum cancer ya de bi ho no kra ya na ye nyante ye na ye nim cancer ya de no wo ho na enso ye nim enu nti ye dwen se cancer no de enima ne prostate the enima ne breast cancer the enima ne nanu January the kind cervical cancer but you see ebinum wo hono mu asɛ nanu kra na mete se mema kwakudo nsuo no kra se etimi cancer timi ye no nanu fiada me kotra medical director okonfanoche reproductive health nipa Dr. Sabin and na o kire me say HPV na ye ka ho asɛm se oba be ma na de ma oba ye nim se oba no agi mum a no ne service na no akwakofa o hawa ba ho na akofa kokoramaba se be ma na nkasa no kwakudo nsuo na wo de HPV ne bre oba no so wanhwe ho asɛm anka kokoram ebetimi ato ho na akofa asem edi abre no ena miniminu abroni ena ehia wa ha bibini to broni na edum so ena ye ba be din komo mimi de ni edum ena me guest ne de ni yeso because broni fita ena ye ni be din komo Dr. Ajoa Asare doctor oncologist Dr. Mwakawa when you ajo who I feel you are very beautiful.
Thank you.
Na meto ne bo de obo wi a o ye de ndi enwumre nti esum sa ana oze
otu ne bobo bia
a wo de ndi wi a o sunshine na wi agina so pa ansa na obo nti ama ye de ne de ase ye tuntum ana o ye broni
de bi patro
o ye bibini o fi asante mantem he ya
me patro de me fi achim me patro
okay ye mo akwa aba on see studio hefe pa ba bia ni ho fe chen ye di
hefe
ye de nyame ase ye mo akwa aba ye da ase ne wo bre a wa ba wo ne ebedi nkomo oncologist o madwuma ne say
okay nti ye ka say oncology in general la cancer care and as ye beka say ye na ye hwe oncologist ni ye na ye hwe omo a enya cancer nti basically would say obi oncologist na adwuma potia oye and say ohwe obi a wenya cancer not only omo omenya but there's also the preventive part of it I know so ye ho adwuma
said ye be
yes to create awareness and then to help prevent the disease from occurring na edu empempen so bi a yare na nya yi ne ho apia ye ayen so ye ginemu ehwe ayaresa no akwantu kosi se nipa no ehu beto no.
Say ye oncology na mo de ne cancer care. Unsi ye won krabata hodo. Yenim say prostate cancer e ba mo beye de but say urologist for nso so wo mu chefa. Ye ba breast cancer surgery for no enso wo mu chefa. Ye ba cervical cancer gynecology oncology for no so e wo mu chefa. Enti mo ye adwuma bom ana we wie dru ba bia na wapia to we nan so.
Okay. Enti cancer care in general no baby ye for bibi multidisciplinary approach. Ye ka say multidisciplinary na che say enye nipa baako ana anye nkrabata baako pe na ehwe. Enti ye ba cancer say de o kan ye ne ye wo nipadua ne baby bebre ya cancer betimi esi free wuti so kosi wona ase. Enti no based on the site no ube here other people so a beba be som enti say yehwe nipa baako a wenya yemfa ne say breast cancer yenim say at a point surgeon bebem yenim say at a point oncologist bebem even before the diagnosis is made no yewa obi a ono na be ode tissue na ayate no ebe hye fidiase pathologist na wetimi ama ye diagnosis no owie diagnosis na yewa obi a ono nso be ebe hye photos a yetwa nipa na say yebeka say bia say yes cancer CT scans, mammograms, ne sanye mani na ono so behwe no wahu ba bi ayare na tretre akodru nyina ono wi a ode be ma surgeon ne ye be ba be discuss aha say ye be ye chemo ne first and I say bibi ne ye be ya ma patient na ye wi a obesan go back for surgery or cause surgery na plastic surgeons in suit to me bem esie de no for ema reconstruction no aha owia obesan abaye ho ni nyina no omu nyina bua ema yaresa akwentu ni ye kama other people to say psychologist because who him say ye kasa when you cancer enye asem ketwanti obi kura one wo be kasa achetre o yare nani so dietitian obebem achire wadidie mu ne niema e wo so ye social worker obi o ho ana sikasem e problem enti e nipa bebre na ba together to make sure say the treatment becomes successful
wonim say aka ne pa ni nim say ka pathologist yesi samale omo papa ifunu pe ye nyini ne ehu say enye ye de tissue ekohwehwe enye owo niema nko a na omo ye ti first de ka say o papa pathologist say o papa ifunu ti say na mo school kra doctor enkwada ni bo aka say on specialize onim se funu nko a to omo so mo no omo na ye adwuma bom
ye ni omo ye adwuma bom pa in fact say omo ni adwuma ni mu a eye den mayen because before say ye de wo beba no e wo say obi a kire say ade na aye yi no ana ade a omo ehu no eye cancer
kokram womansa
answer inti say obi antimi an kire sa ade na ene to say
na adenti na efunu papa no eteki center stage e wo adwuma ni
oh I think say ebia eno na people knew about ebia no no mudi kan hunu ye
another time na cancer nye common
that time no so ebia na diagnosis no yenye ni bebre te say they say ya bohu de ru bebre ama yate no oh cancer there ene yen atena enfie dodo bebre dated all the way back but I think say now na say nipa aye more aware first no na bi obi we kra say yes ebia ne ha ho no bibia beto ne no fom yes ye duabo first na bi on fan ko hospital kra na ebia pathologist bi akoyi na pathologist ahwe but ene no sa awareness ni nti ama nipa bebre ko hospital e wo sa yare we hu nti ema pathologists no so to me diagnose my into they've always been there but I said they na ye hunu ne more no e ye so obi awu na ye de ne call for postmortem but omo adwuma omo ye party chiwu no e ye more of sa histopathology
okay na ye se cancer ne atena mfie dodo anti mfie dodo ya na apomuden hwehwemu fo muntimi hu adekro potin na de yade ne ba ne ye nchi ne nyina ho ne ye hu ko e be fa so yi na free ho research bebre ba ma ye nyina
I think say research no kra na dey aba bedru baby aye we so much has gone on and so much is still being done cancer no aye bibi aye be ka say abre bia edane ne ho enti no ene de wunimu se na nka wo betimi ede na fa kwan sei so no abre bia no so na ni ye den na ni ite no change
novel na ya na muso mo maba foforo na o chi na no odane ne ho
but ono wo hoda da no kra na their ways omo ni it because yen so you find the ways against them it will produce a draw way na ebetumi a chi na this stage no no so na ni ate no afa a different wafa different side into no every time there was more research will go into it but what they make it's been there but not it maybe make us say the technology to be able to even know what was causing it, some of the risk factors that brought it on, and now say even technology and no advances yes obetimi atnase and now machines so oba oncology obe hu say cancer na nye panie dru na de friend kimo nko an ye de hwe there's the radiation aspect your friend no say bia you using machines akese your linear accelerator your cobalt machine brachytherapy say wo ba wona sometimes machine no kura esi ho keke no hu say
enye na mu de de ba na mum efidie ne kwan ya mo befa so amo ne be ko de mwanya bi ti efri sa abre ye ni da so ho say nyame be boa ama enche ye be hu say ade we pote
eni da so bebre wo ho because first no kra no na ye hu na sometimes treatments no kra ne bi wo ho a ye hunu say ye betimi aye but na e bi ni ye man yi mu but say there's so much available and nyame adum there's so much we can do for a patient and yet to say first na cancer ye death sentence na ye kasa when your cancer say bio na unim say enche wo ko say there are a lot of people la ye to me nyame adum some have been cured or more ye to me cure mo no so ye improve it what will say their quality of life into at least almost so we nije kakra wo enti no enti se first na bibia no na mo wo kwan so na nyama bebre asesa
na ade ntin so na ase ni treatment no ase ka wo mu kakra they say the idea am hihiem say mom ko fa psychologist ben nyina fisi enya boss cancer na ye wubusuani a mo wa asase bu ana open krata na ese wo koton no ade ntin na tisa
okay first of all no cancer is quite a complex disease ade bi e complex bia no Mijidi say when you are trying to cure it or when you are trying to treat it, you need more than one thing. Inti so you say a breast cancer cry won't mean you see chemo it will say we surgery, it will say we radiation, and all those things are novel technology. They are advanced. Enti no uko abrochime mu a sa niema no mu use ni bia na yesu ye use but wo hwe ye de na ye ni ye mfa ne say insurance to cover some of these things because they are very expensive then na den ya your treatment be expensive because your cancers na apart from breast cervix and prostate no they are can nyina ni insurance so enti say aban kra to say other ones aban so mu kakra na wo so mu bia na enye din bebre but other ones no it's not on insurance and nyina you have to pay from the pocket enti unfortunately that's what makes our treatments quite expensive
apart from these three common ones our bonuses here breast prostate and cervix no other cancers ne bi ne dey ansa ne akọ risk factors ni
cancer there I think say from uchi so ekosi wo na say any part of your body you can develop a cancer
nipadua na kwa bia
yes apart from two places maybe I can say offhead would be uchiwi and answer one samore and open e bia make say ye hu say cancer etumye pie go but uni pedua ne baby our skin our eyes our nose any part all the systems or oral cavity right to your digestive system na baby aye didi aduane ne faba baby aye ye home efa no sa ho no nyina ye fumu emema your prostate then ye di kanka bladder any organ or cell within your body can become cancerous
na ye den na betimi become no
enti ye ka say cancer in general ye den kra na cancer na eba yenim say ye nipaduane is made up of cells anade bibini beka say enkwamwa na nyankopon ni nyansem no ye ne say enka o cells na say enkwamwa no eye adwuma bia ye nipadue kwa ye adwuma ye de ye bre anaka ye adwuma ebre inti cells no mo ye adwuma edru ba bia omhotumi tochima said there for example me yen susuye bia ma wate ase ye ka say and I say wo talk afofra wo de nanti e den a problem be ba ho
anya hwe kura wo yo be wi abuto ko change
enti ye be ka say wo de be ko mechanic ko mechanic no ne be hwe ehu ba bi a problem ni fiba saa na ye nipadua ne tie ye cells no eye adwuma problem to me ba ho and I say to me bre nyankopon aye ne say odi niema bi adua ye nipaduam mubroni be ka say repair mechanisms eno sie cell no se bibi touch ma ono ne ba be sie enti se wo de wo car ko mechanic ko eniema mienu miensa no obetimi aka cho se car no bia metimi asiesie
ana
mintumi nsiesie we de aye condemn ana we de me try de aye condemn no na che se wontumi nyusi biom car na agu
ton condemn
yes
ton ma condemn ya zo ntwitwa na lumi
ena de obetimi asiesie no nso no osiesie wie betimi asi kwa so kama ebi wo ho osiesie be ye perfect ebi wo ho osiesie problem be ba ho wo kwa ebesan akose saa ne nipadua ne tie se wo repair mechanisms no problem ba ho a ontumi nsiesie ye into instead say nke bia wo beka se we de wo cell we na nye e wo se ewu no ontumi nye ne saa cell no be kosoa ya adwuma na che se enre na so se nke wo se wo free homa foforo be hyem no ono de onko you keep on multiplying saa ko si se ebeye cancer pacho what dey make na say and I say we repair mechanism so ebi wo ho a otumi siesie ba on siesie ni ye because of a problem na che say there's been a problem with the repair it is said there ojai wo cell no man e coin afi no ne function e wo say perform no entumi nye ne saa pepepe enti se na ka first no nke wo say oka niema mienu bomu a say no obeka niema be 5 na abom enti no entumi nye ne nyankopon ahyehye se enye no
na no isa repair mechanism no den na ne ho aba asem yi
enti no repair mechanism ye wo ways a ho betimi aba asem sometimes obi wo ha unfortunately ye de wo no enti owo genetic predisposition ya wo no with that problem with the repair mechanism or ye wo
likely say say nipa ni benya problem no
they are at risk of cancers enti no out of enyo no ne faults saa na ye wo no genes na ye de wo no na ehun wo problem
na mistake be happen during pregnancy na
enti ye likely say bia ne maame ana ne papa wo that problem and that gene na ye mutated na wa pass it on to the child no
na ne maame no pass ye no anya cancer ni bi dada na
what happens is that bia ne maame no entumi and develop cancer no but
due to what reason
so apart from say repair mechanism when there's a problem there are other ones that also come to counteract it into onipa ni nyese wo repair mechanism problem pe na wo say wunya cancer pacho what dey make na say there are other mechanisms so e betimi abe counter side effect na ma cancer no into me show but obi wo ho a during the lifetime no so other things are e won the environment mu lifestyle changes bia chemical bia obey exposed to bia radiation you can say radiation and nyema e free yes sun no prema radiation and I say x-ray CT scans into sun nyema no exposing na etumi ma ne repair mechanism no already problem wo ho no na ekowesen no na ma ne gene na ye mutated into na the cancer number but sometimes too ebia or that genetic predisposition but the environment no ebia obehwe ne niem obehwe na didie ye obehwe so exposing ne ho to sanya man sometimes it will help to protect the person but in most instances no when you have that genetic mutation, the likelihood say ubenya cancer is high, but it is not like 100%.
So it risk they can say a chance.
Yes, it's per chance. It's per chance. Ne mami enya. But or passing on man bano. Other factors are ba amane bana ye more at risk. Into ne bana bet me develop.
It is a repair mechanism we know. Eya cancer ne beto baby a problem ne wono. And I say it me koto baby a ope.
Enti no cells ne wo ye nipadua no baby a wo cells wo heart no wo cells wo cervix no wo cells wo breast no any part of your body there are some of the genes they are specific for particular cells and tissues and there what other genes they are general enti se wunya a problem with that gene probably a general and yet only for a particular part of the body cancer no ento one place pe it meet on multiple organs
e woni pa ba ko
enti wo be hu se nipa ba ko wenya breast cancer that same person wenya ovarian cancer and I said your friend ovaries. That same person was saying maybe a uterine cancer.
Hey.
Is because say that particular gene, no, for example, maple gene be the friend retinoblastoma gene, RB gene. Say when your problem wo ho a, e betumi cause multiple cancers in multiple sites. Ti do that person no, obon say bi abrochi me obi a say me what my test me say me was agent ti munyi me no for me no ento ntwene.
Utimi ba o. Utimi ko. Na ye hwehwe say sa gene retinoblast ewo
yes,
Ghana hanso ye ne sa
ye was sa na man be for example obi and the family breast cancer ewo mu no ye frɛ bibi BRCA gene BCRA gene sorry sa gene no eno na increase wo risk of breast cancer in certain
the chances say obenya na high
into wa hwe hu say ne maami nya bi ne auntie nya breast cancer ne sister nya bi then they go obroni kwade obefre other families ebi ama ne member na wo family no ne go ye de go through genetic to screening, make sure say to make sure say you don't have that gene. So sometimes when they have that gene, now you say will risk of getting it here higher. Sometimes they can no that you go for a prophylactic mastectomy. Not just you know for no. Na ya na they had drink a cranny say ya ni if say other cancers no so baby. Into ovaries no so say ubetimi a develop cancer or ovary. It is any pa na obeka so and you munyi me ovary free ho because and also your risk. Into to say BRCA gene no and no a very yeah, because say a gene be as a bia unya mutation in it, it can cause you to have breast cancer, ovarian cancer, and then other genes to it's me a multiple site. But there are certain genes in so I na a related to one site. Into no need there, maybe a ubenya no a particular cell and a particular tissue, but enconco affects other ones based on the kind of mutation or
Dr. Adjoa Sari a oncologist ono ne yedi ni di nkomo efa risk factors ya e wo cancer mu kokra me ade na wato nebo echiechire mu sa e de kire yen nti wo asem bibisa won say ya me so me kire me de won so kire wo de to ho ebre ne so ne ye bie kwan na wo de wo de aba no aba abebisa e live e o Facebook nti se wo pese wo hwe de ekoso ni bia fa phone u mai TV a fa phone ne ko Facebook e na wo se media me use DSTV etimitie radio mpacho Kessben ye o DSTV o Go TV enu nti ko ho obehu ye wo ho na wakwa akohwe enu bi e wo ho doctor empanisi bibi ankoka papa ubetimi dia to asama me na ebe onya de
papa anje trade
aha na say doctor tebe good etina chese sa ne ma wo kan e bibi na bekọ akọ akire risk no wo ho genes no ye hu wo mu se de edi kan risk factors ne ba akọ ne egina ho a ye nko ye nimi e de na bekọ akọ kanachi ama na ba nti se sa de ni bi wo mu asan na me bo me bra
okay into risk factors in generally you can say oboni beka say modifiable and they want to mean modify into they want to mean modify na enu bi na maka no DNA repair mechanism wo problem wo mu a wo de bia ye de awo you can't do much about it onipa bia wo nyi a aging is also one of the factors that you cannot modify wo ye den a wo den wo benyi the more wo nyi no wo toka 2015 a enru be 2020 na wa ye mre
eno kra say nyi ntemo e ho ma 10 ba foforo ye free 09 ba 10 no am say na ye AST edru Z after they started 10 11 na one for always ke ba say aka ni na e condemn
wo nyi no na wo ability to repair certain cells na call from tika first pan na nke yete cancer obi a wenya 60 years and over 70 and nature said there are other factors that have come to influence it into aging and so I know they want to mean nya ho hwe or genetic mutation na ye dey awo and I say you've developed it you can't do anything but what are the modifiable ones e dey na ye betimi aye ho bibi. First thing is the lifestyle changes. What are some of the things that etumide cancer brain? First of all, big the obroni beka say smoking. And cigarettes. One of the risk factors.
Cigarettes. Nka ho.
Pacho de.
Bonsam ta nka ho.
Yenim say is the tobacco that increases the risk when it comes to smoking.
It's a cigar no money.
Yes, exactly. Okay. And then yenim say smoking
no shisha so.
but you know the minimum de kode and na smoking na ye ka ho asem no e ya na ye say oh me dey smoking dey me nka ho me nko fa smoke bia unfortunately ne wo a wo twe cigarette no nko an de wo a wo hom no wo nso wo risk wo stro nti bia kwara bi wo ho a ne papa enum cigarette one na tena fie oni hu ayi bia enye ono na enom ye but later on
papa na enom
later on no akwa develop e bia ye beka say lung cancer and I say cancer in any other part bladder ca and I say bibisa apart from smoking no you have cancer ensa alcohol and also your risk factor and depending on
smoking no ne dodo a wonom obi beka se omi de me asa wo de me na matwe kakra bi na memu ayehye enti ne dodo na wonom na na se dodo na wo benom no ana se ewo ma na
it's smoking no cry no nye say bia one stick or two ye free bibi pack years no ye calculate over hospital ye calculate until you see a number of cigarettes will be smoking in a day times the number of years na we smoking no and no increase rate until ye obi was smoking for 1 year na de was smoking cigarettes back ye based on the size of the cancer volume it to me increase or yeah they will risk and the same way no with even alcohol na make ho asem and also no yeah what the number of years one nom any the type of alcohol say
type no
yes to say spirits any genes no
yeah local one yeah fall away
and no falling very high when appetition you when a hard drink pa what they compare to say red wine and this money alcohol content no and as high as the spirits and the genes
no man woni my basa
and then no increase will risk no but yeah na some you no smoking the alcohol they come together into baako boa ne nyonko e ma cancer into so bi wo ho a no tu ni na nenye will risk was pa and there are certain cancers smoking the alcohol more risky. For example, cancer bia a free wenum oral cavity and I say be a friend head and neck cancers and now with throats into ABI Rebecca said larynx wo hypopharynx oropharynx and your money e dey call no and a stomach cancer because kai say nema na wo nom ni nyina stomach no man san baby foforo bi ebeko and a bibi to say smoking unim say lung lungs num direct into tobacco ne ko deposit wo lungs num into ebe increase risk of lung cancers into based on the risk factor and also no site no a bit more specific pacho what the American say into other lifestyle bi wo ho a kese keke
yemra me enfie ho na nsa na aba kese no obi se me na wo na doctor ne de no keka no me num cigarette me free me nkura brem em se me di be enfie aduonu na me sha ase no mo se me ko 70 years cancer be ye me ankanye me wo sha ase no mo ya na eba ana edu brebi
so based on the kind of cancer no na risk no and a number of years na emma no for example solid cancers ni enim say whatever you are solid cancer so like a tumor they find say like a sarcoma they mean how to say it sarcoma the muscles no bia and as even lung cancer no
na ya na ma bibi as
abefua o nine and as
edwa na abehye wo
na bia ne nine ho baby ne nsa ho baby and as bia even lung cancer a number of years ebe because kai say ade na wo nom no wo repair mechanisms no ye ho adwuma wo time bia no odrub exactly into at the point na entumi nye biom no that is when cancer ne be start ayede develop sometimes one cell and sana cell ne be multiply kakaka and sana abeye ne ebeto ho a wani hu ani boso abehu se bibi abe hye me ha no ebe ma wo enough time and abe ma wo so many years answer and obi wo hokra nan so a onom cigarette ni we na edu baby a ojai yenim say for certain cancers no ojai maybe after 10 years no or risk no comes back to normal person into I would encourage enkachi
utumi jai
enka say ebia o baby amanu akobi de ye de ya see a what is so de still no risk ne wo ho see a what is so ne de but say wo to me jaya and also cry no ba hospital there are ways that we can help to help you, especially smoking and alcohol withdrawal miss anima ye betumi aboa na unko jai because wo jai prekopa na no so wonsunso so the body has become so used to the alcohol into wontumi jai all of a sudden oba ye be ye wo ways ye do be fem a betumi aboa ma watumi jai na nkofa problem bia embre obi wo hon so a obey lucky obenum sa anima we na cancer ento no
as a cancer no hwehwe animu cancer we hwehwe animu
sometimes it will just be chance or you're lucky and he might never get it but someone might be unlucky and
you know most risk in a chance no
you know you might not know say be awo de obey lucky and
so utia na utinye
ye de ro na ye bon say be ya enkodru that point obeka say oh me hu me ya nka me jaye no ti ye gusu to hu anamo. And the third one I was about to talk about was obesity. And I say, Rebecca say, Osebia obiso, and I say, your high BMI. And you know, yenim say obesity no is also related to other cancers because fat cells no or amani panaye kese no there are certain jumedie bia edi wo nipaduanum and anyema bi wo ha they are related to increasing your chances of cancer. In time bia yebeka say try to keep a healthy body weight. Obia weight no based on what height no there's a particular weight what say we bro so to me the problems but nye cancer and there are other conditions, hypertension, diabetes, and that are also related to obesity. And funny enough, funny enough, these hypertension, diabetes with obesity, no, these three are also risk factors for certain cancers. Yes, certain endometrial cancer and as a cancer the three common risk factors are obia also. Now all hypertensive, no sign yet diabetic.
As always, or pressure, exactly.
No, it me increase your chance. It's a case time be my yet sedentary work. Unfortunately, say so. Ye jumani nina ye fa kotena. Ebi obeko office no pa betina ho akosi anwumre. But ye encourage say ukofia 30 minutes walk bi kra na wo de atwa ba bi a wo na se hwahia. Oh, brisk walking. Most of the time brisk walking eboa. I will say ye bibi so ebe mo asset sweat kakra mo hu say wo exercise. Yes say wo na ma. What say oh because right now bompa now ho team fifia won che dan exercise because muscle now wo exercise that are probably your hands maybe a wo bompa wo bonsem enti wo team fifia won sano pe na wo ye den wo exercise but exercises no e wo say wo muscles na e wo body nim say wo nama wo to wonsa wo to abasa wo to wonan say wo ye ne tentem wakoma na ye den e bon tentem wo you see wo muscles ni nyina wo you see wo adwene kra because wo kono wo hwe ba bia wo ko into you are exercising all your muscles as compared to a be adwuma ba ku bia say bia ma ye say o ye wo fie ye adwuma no pa ko si anwume ye twitwi bathroom ye say ebia you might not be using all your muscles at the same time. It's na you encourage you say
so should I do the exercise?
Yes, find time for exercise. Walking a very important and a very simple exercise to help reduce your risk. And they say chemical carcinogens and as a chemicals. They say chemical nyema be brave try your ho ahia chemicals. Into your hair enyema kra ye di spray ye nuane so ye no bias so
ye can see ye bo adru
e bebre ye chemical ye dey tie and dye colors ni nyema na ye anything se wo hwe ye nhwehwe ye mu a ye hu se bladder cancer ana cancer eto ade na ekra ye junso twa no mu no and no one of the things that ye hu pa ye omo you see tie and dye tie and dye so chemical no mo dey ye
now how does it get there?
So it's absorbed through your skin wo de wonsa se not it no ye tie and dye omo nche gloves they just use their hands exactly into be absorb it so chemicals no through your skin and it enters your blood the same way omo a ye ka say
hey exactly
your skin no your pores ewom enti adenia sweat wutin fifre epie free ni pedwem saa na bibi ka wo honam a ebetumi awuram saa na chemicals bi ete say omo a hairdressers even omo permanent creams omo dyes no omo use no eno bi wo ho a you can absorb it into your hands enyema ni bi wo ho a omo inhale spray no omo bo spray ni efre bibi organophosphates no saa nyema no wo spray so nyina no na wo so inhale bi ko mu even in the normal air exhaust fumes dust fumes
I just pipe ni mu ho
nyina a lot of them contain chemicals which have been found to be carcinogens and as we inhale them no saa nyema no to me komu ko destroy yourself it is
how you tie and die and now wo hairdresser o twe enkrofoti any ade na na say wo say abribia wo di bibisha wo nsa
bibisha wo nsa to protect you say gloves omo tie na ye was special heavy gloves ni bi wo ho a wo sha e bi e be ka say industrial gloves no industrial gloves na no wodi ya wo be wie no bon say bibia enye den eni wo nsa ho enti sa wonim say wo ye that kind of adwuma wonim say wo bo spray e bia wo ye farmer wo na say wo de wo adwuma ne say bia nkofo be fa koye sa na ma ko boko ko spray koye say ya wo set time bia wo she protective gear ye was special ones bia wo sha ade ni ntumi nye den enwura wo mu enti sa na ma no beka say it's related to your work adwuma wo ye ho hwe enti wo na wo say wo bo ho ban ana wo hwe kwan a obetimi esisi sa na ma na ebetumi akwa damage woni peduano and another thing so I'll talk about is radiation na me kan ho asem yesi ekutwa x-ray ni sa na ma no the commonest radiation that we know is from the sun yenina ye na mawia so ko benya ye radiation e koyemu
say anopa de mu say vitamins
I know they very early in the morning you still get the vitamin
na yes coaching na.
Oh, even in the morning, once it's coming from the sun, there's some amount of radiation. But God being so good, no, that radiation is very radiation. Say yesusu ne dodo na very minimal. But it's also a risk. And untina ye will be memo hano. Yankopon aboa ya ama your skin bia etumi protecting from that kind of sun because we have it a lot. When it comes to skin cancer, one of the risk factors is UV exposure, which is from the sun. And
it's not just say we are never me and antiswana.
Oh, me can say my antiso. Make us say there are some things you may be able to avoid.
Like
want to me avoid oh big tongue idea or tongue idea where we are so to me can't change say but what I'm saying is that these risk factors they come together to cause one particular thing. But what they make
one risk factor.
No, they are making other things. Becky can't boom. Into bia so be beba so baby sano. Only all these risk factors into when you cancer.
And no ya additional by phone. Dr. Amos was say disease causation. You won't see forces supernatural. What you can't do anything about it. Me na minim say medically mujitum say there are some until say you could see our school ni who say near disease causation or ka say if you are no more unseen unknown who name the nam so I buy
but cancer ne dey we know that sometimes some people will not have the risk factors but they will still develop it because of that DNA repair mechanism. Now make come wasem.
But so we describe that one too as a risk factor.
It's a risk. So the thing is, it's a risk factor for obia ne DNA damage or a problem with repair mechanism. But we as human beings ourselves, no, there may be a problem with your repair. But at DNA it is a mechanic. You cannot trust your mechanic 100%. So obia repair. Adie during the repair, something might just go wrong. But what did they make? And I say when you have a problem with the repair mechanism, it doesn't say they say ubenya cancer. No. Other risk factors will have to come together. That's why I'm saying cancer is complex. You cannot fully understand how some of these things some of these things develop. But the name said some of the risk factors no to me free to do no it's a bit protective. But all being said, one thing I always believe in because ye na ye Christopher so Dodwana yenim say yenye Christonikwa, we all have something we believe in.
We believe in the existence of God, but
yes.
mode of getting to him, no.
So I always also believe that there's always a higher cause, because for all these things to even take place, but sometimes we as doctors, no, there's a point you do baby yen to me because it wouldn't make sense. Say be I will say risk factors wo nipa ne ba we busa no sa risk factors ni nyina onye de onibi,
and so
cancer has developed.
And no, baby says, how did that happen?
So
Reverend he preaches a CR, TM said, no, and it also can say, on the kind of positive, or say a few way a woman, Yami who may kind of huntino. How did it happen? Miracles, very common. It's yes, Sarah. They say, how did they happen? Miracles, nanya more. Chance oncologists, baby, say, risk factors in na neniho. Na a day and I say, deal with you too.
No, in American say, so sometimes you cannot explain it. There are some, because some of these risk factors can see Sudan or mutumi yesterday near Shishemu after 10 years near Becca so we can risk factor biome. But so that's why still research is being done to find more about cancer, because you realize that sometimes the person doesn't have any of these things but still develops it. Into a risk factor, the risk factor at the betchini the abeka. Exactly. We also rely on God to keep on giving us more knowledge to be able to know more about this disease, because it's quite complex.
Cancer dangerous one pa say mukoye histopathology na e ba say nipa e cancer we na to ha muhu ya mus ayenwe de musi de mo mane ho ahwan ke mo so ano
palliative care bia ye ma palliative
care nya de a obeko.
Choosing one particular cancer will be difficult, because cancer
but enye den ya ba ko bi wo mu a onipa ni nya e te say stroke ya yes start free nipa ni tirimu na enwunu say si ni tirimu entini no ateno say hemorrhagic say eno no munim say nipa ni nya that kind of stroke ni die the probability say obetena se no e wo fam, but e bi a nsha say emfiri ho na e bi a nyodwoye ne ba enim say ye de ne fam kakra ebeye yi ntini nyina ehu de nanso cancer bi o hono mo a mote amoye mo hyemo.
Okay, before I answer that question, me pese me can be kakra say when we diagnose the cancer na ebia ye be stage ni pan ye be hwe ba bia akodru nti ebia ye was stage 1, stage 2, stage 3, stage 4. Usually generally cancer bia spread from where it started from, and now from ye be ka say the primary site spread ko nipadua no bia no ye be ka say stage 4 no most of them to me into us here. Obviously as a doctor because you have to tell the patient say mean to mean cure. And most of the time stage 4 cancers generally na yempe.
Yes, any editing few money do stage.
Exactly, because say nipa ne beba no na edru ho ebia wo hu ne ntem o anye ho hwe ebi so de ane na ne na baby kakra koye bibidro kakra o de akọ ha kakra
ada bibidro ntumi into cancer.
Oh, bibidro ntumi into cancer say. Yes. I know that I think I can say it for a fact.
On authority.
Yes. Say bibidro into cancer say. Because
ba nyame de obetimi aye.
Oh, nyame de otumi ye bibia nyame na yaresa woni se. But a bibidro de minim say into cancer say. Because when you look at the idea really bane how complex the cancer cry is now, you know, say you can't even use one thing to target it. Also, we're targeting it from various sides. Surgery bebem, chemo bebem, radiation bebem. It's not just one thing to say me ye herbal medicate me ye herbal quality to us no. Because so I wouldn't understand why it would be better say or no they no my herbal medication. It doesn't help. Generally in stage 4 cancers. And now pathologists ne share at the end of microscope na se mayen otumi mayen the type histological subtype. Into histological subtype e bi wo hwa ye friend favorable ones. There's a cancer na nya de papa de but ye will be a omo nya ho meti. For example, ebia yeti choriocarcinoma and as a cancer enam nyinsen mo eba. Eno no ya na eboye hu kra mo ye hu bebre because ye nim se eye cancer bia wo di chemo kana no wire into
na
those
kimo na mo
cancers
de kana ye de ani kimo no
into chemo ni ye beka say pani ye be explaining as IV medications chemotherapy yes chemotherapy drugs ye de ma etumi cure cancer nti ye hu
ye na tutu ye tiri ho no
eno na tutu tiri ho no
okay
nti eno ni mo ye hu but cancer bi wo ho a to say emfa ne say wakonya histological type say bia for example neuroendocrine cancer ye nim say that type nan cancer cancer bia ne ho ya hometi because one chemo no cancer ni resistant to keep with that particular type resistant to chemo or no resistant to radiation or no how we surgery untumi enyi ni nyina internet say uniema a wo de be na kade a wo de ka ni nyina no obe find the way be of evading it
ya no de obe ka bi obe
ya no enti no ye mpe eno so ye be ka say ye bad histological subtype na cancer bi wo ho a time pe fa akotena ebaye within when him raso na nipa ne mfa medru wanim no na akọ hrawem na akọ ne brebuom it is our cancer no so yempe because onyini intentem or orerewura ne baby ani so wura ebe ne ye de friend sarcoma de na me describe ya cho ti bia ohun se dro bi afu ane na ho enye me ya enye hwe efu aho be 5 years
me dey free me nkwada brem
unfortunately in some kind of cancers no omra no na edi kan
ya na ta be say ya hair mu
usually the lower limbs no ne ebia upper limbs no na ba could be one type of skin cancer your friend melanoma e cancer bi a yempe go ye teen di ane nim say by the time I mean his yemfa ko she microscope say mamme no na edi kan ko nipa na hrawem dada because ebiamfa ne say thickness bi a mehia to even diagnose it no atra saa no ti nipa nani mra so say mehu ade tuntum bi say da me honam me de be ko hospital ansa won kokra
ebeda ho sen bi ana obi tie bi ebeda ho tum
nti ebia some ebia bibi tuntum eda ne honam enye ne ya nti first no
epeja
ebi e flat ebi nsu tumi peja kakra ebi wo ho abehu se nwi ba ko mienu bi tu aso but emfu nwi bebre bi wo ho aya na katete no mbeka se bi ete se birthmark ebi wo ho a just the birthmark eno de enye cancer but ebi wo ho asa na ba ti just da ho enye me ya enye hwe just a color change and enke kame enye hwe nti by the time now when him so ho se ebia kese and e ho start ye me ya no by that time e kwa wahrawem dada and unfortunately ni sa yare ne de na boye hu kese wo ho ne se ebia enuro na e wo se ke ye de so ano no ebia ye hanom no ye ni sa ne ma ne bi e na ye wo bi kra na ne bo no nipa dodo na ntumi nye den afford nti ye hu there's the headache of ade we ne treatment enko ye dada
and oncologist you always go home with a dwindwini o na she said patient ni the case ne ba won na busu afford dwen ba mo so mo botae ni se nka mo beje nkwa nyame be fa mo so ade nkwa ma ya tena se nti se nipa ne ba ne wo da bia mo bokfia mo ye stress do ana
nti I would say that it's one of the jobs it's quite emotionally involving because aside unim die wadisua ene niema no e was say wo ba to the patient's level to try to understand what he or she is going through mene wuti he minyi ni say obia bepe at any point say ye be cancer diagnosis we are sure because sometimes who breaking news need to the patients now wo hwe nanim no or hwe wanim na you can see what is going through already no but there's so much fear
and what confirm
there's so much going on in sometimes it's challenging because you might have to be as truthful as you have to be. Say it the way it is. There's not much, or what I would say, much. We cannot give you a cure. enti minim se sa asem na me be ka kire no enye wo de
o ka kire me se meti we da bia metimi ewu
enti me be ka kire no I'm anticipating how you would take it and it drains me emotionally
and so ya na mo dwen ho se esese e ka kire patient ne nko ana ya na mo ma relatives kakra ba o
it's a patient's choice ono na be decide e bia oh me ni me gura ne baaye me ni me maame me ni me nuanom enti bia me pese obi wo ho a on pese na busuafo obi abeti enti eno dey you have to respect the patient's wishes and make sure say unye bibia e betra de ono no epe no enti aside from you also breaking that news another emotional struggle to will be sometimes to tell them that I would wish to offer you this but this is the cost and knowing say patients nenye den into me ntua enti no cry na no so you stressful mom because you feel say there's so much you can do for the patient but unfortunately because of financial constraints enti there's not much you can do enti no so ya quite stressful for us but nyame nchade no sometimes with even patients who can afford there's always a way out.
Kessben Foundation minim say what yenka
no this is
Kessben Foundation
this is the first time I'm hearing
Kessben Foundation Kessben lawyer Stephen Boateng and the brainchild ono no de baaye ye boaboa nkrofo enema bebre ye de man nkrofo set said ye kan say ye bo advert say bia wanya cancer fabra na emu wo but o ka say dru bre bia na e basa na ya bo awrem na ya bo nipa no obi aba unim de ebe na nipa kra age no nkrofo bi te say Kessben Foundation aye niema bebre mankrofo bi oho no mo in fact ye hwehwe mu ansa ehunu se nipa no kore pa se ohia sa amoyi ohia na dim ka se ye obi brainchild lawyer Stephen Boateng ni adwuma nyina ewura ono no de sa ade ne ba ono ne ho kani na nso so afoforo bebre eka ho obi taku obi sempo na ode abeka abom no abeboa enu nti ye ne sa na se yenua bi ho kire na ne ade bi akoma no nti se obi ono ma de wo kan akofa aba so opese wo boa uko multi credit branch bia wo de okọ house Kessben Foundation and na opese odi scan bi ebeto ho wo de kwa ye beje ne de aka ho na yenua bi hu kire na yesu yetimi e de abo fi se de wo kan de edu bre bi aba akofo pa de ontimi nso
when it comes to cancer crowd nya de aba akofo betimi aso nti I we bi aye friend me mama kasa bi I always try to use the opportunity to tell relatives family to support our patients because they go through a lot. I always see them as as heroes because to even get up every day to come to the hospital with that expectation and to know say the ya ma ono ebeye juma wan kasa and ahokeka ya na sometimes omode ban me kwa ya na eye me wan wan be
survival rate ni say that saying
so survival rate it will be difficult for me to give you percentages now because it's per even say disease sites in tibia breast cervix ovary prostate ne sanye man
it's disease sites in the na wosoro.
So in Confanoche breast cancer or infant oncology baby I hear one at a point na yes cervical cancer some years ago but we've noticed that now breast is in the lead
oncologist what is the problem e na amenu na ehuredi cancer
say I think say there is now the creation of awareness. People have become more aware of it. So at first ebia nipa say to know how many cancers come they have to come to us and be registered into the cancer registry. Since a patient ninya cancer no tifie no wa ma it cannot be registered to to me sure. But I think say yeah creating awareness say in so October bia a breast cancer awareness month yenim say utumi kokohwehwe no fumu and nipa ka ho asem bebre am ye hu say cancer and chese ube nya breast cancer and chese ube inti nipa dodo na aba a lot of patients come inti ama now awareness na ma e pushing nipa from the districts from baby they didn't even used to at first nanka be at TV ndro and TV ni radio other romance you know ye body row
and programs of this kind
inti obi beti ohun se bibi dan no form a ka first no the base ye de edro ayi e bibi dro bi akoye ye so ka say oh say ye say mo bi wo baby mami inti obeba na ya hwe inti ama awareness no ama sa na ma no ye hu say breast cancer no say and in the commonest one we have closely followed by cervical CA.
no ye common pa.
After breast cancer na cervical cancer.
Okay.
Then cervical cancer no no dey nim say to awode na no and related to HPV ya ka ho asema eguso ebo ho deru. And now when it comes to men, the commonest one is the prostate.
Okay.
You know, so they are very common or they come with.
Me ba be phone lines no na questions no dia aka no megaya ma ona wo watimi ebisa na ma me no ni nkomo emfa BOG vinegar, balm of Gilead vinegar, vinegar adwuma mienu, inte este na chese internally it can be used and afi externally so ubetimi so assign adwuma internally no ene no say wo di kakra begu nsuom na wanom wo di kakra bi gu warm water mu na wanom wonom a eyiyi untini mu ema moja ni timidi afru sane wonom saa na eboa ema cholesterol ya agine mu doctor say hypertension any diabetes ena wa ye kakraka risk factors na ka ho bi na so saa ne ema we na timi efri woni padua mu a risk ne atwu free mu kakra eye BOG vinegar ena mede ma esanso boa ema immunity ne ekosoro repair ya doctor ye ka ni nyina no say immune system no eye strong wa etimi ye ho adwuma ema bibia etimi koso me kanfo BOG vinegar edi amount me se fa kakra bi egu warm water mu nanom enye adro enom ne se mienu anopa mienu awia mienu anwumre enye adro na emom ebo adwuma ema oni padua no etimi gina brane eno no ye internal use. External use ne so ne se awia ebi a wo fie wanwa mo kakra o pesen ka wo ye o de vegetables kakra bi egugu so obrofo semo aba na wo wie me ba cho wakoto fridwa so na aba edru ana doctor eken wo se ye bonro gu vegetables so ye bonro gu fruit so enye okuafo no epe enye okuafo ne se oye bibi dia bese wo se de be ya eduaba ne so obema moa bi a ene obeche ne wie no obeyi wo mafri so nti wo de be fie saa na pe wo mota kakra pe nsu a enye nwunu bebre na fa BOG vinegar no fa bigum wudi bi egumu wia fa kakra ho krosa ne ema nyina ho wo wia ekumu moa ne nyina obroni fe se ye be detoxify no eyi moa wa eyi fi eyi ne ema nke ko ni padua mu a enye no wonom na ko ni padua mu a eyi sa fi ni firi mu enu tu sa de kokoro ho na wo wi o na fi die eni che fakra balm of Gilead alternative clinic ene de sa edro wei ana ede sa emoa vinegar abadwa so a eba abeboyen BOG vinegar pebi fakakra gu nsuom nenom ebe yo ni padua mu adwuma fakakra gu nsuom fa wohoro watoso de ho fa wohoro fruits aduaba opese wudie ansa no wadu be hu se unni aduaba bi wie e ma ensa ankofa o how bia emfa mrew multi credit savings and loans limited savings and loans company a ejina brand ne ewuza for multi credit de wode yan na wode asem ne ebeka se ebeye no eno a ne ebeye ne ya adwen se ebeye ama ne ebe na no me nam krom mi hu se nkrofo to o mo kaase mu ka ne de yache wi na mom ne me ne wo ka ho asem sese se meka kosi se BC results na ba ye twa placement ne ba you appreciate what I'm telling you oba ne baba ne yese ye de na kwa Achimota senior high oba ne baba ne ye de na kwa Wesley college abaya for school fees ne the amount chobos aye wasem okrampo de obompoa o mei boboso enti de otro BC ya obekọ eninwa ba akonso awura form 3 a nyame ya adom anhwe afie anasa afie besim no ono so beko enka achi ma multi child account eye obada ache eni dwuma borua multi credit branch bia wo de wura ho no mu a wo se matese ye ka wo Kessben se metimi abediska bia beto ha ne duru se me mani bia school no mo kwa menya bi e de atua wo school fees ko wo de taku to ho wo de simple ato ho ebrebedru se oba ne beko school no na sika na boma e basa wo betimi akwaji bi na me ya wadom mpo a e bia na sa abra no so nya sika pudu obi wo de ni nyina akoka ho na wo de oba no akọ school na ankofa ohaw bia amfa amrew ya sign abe studio ye ne Dr. Ajo Asare na edi nkomo efa risk factors ya nam so makokram eba no mienu aba pa humanity dunsia baby edre ma me phone lines no e ma metiefo ana doctor pese odi bibi ha
there was something and person me mention about the risk factors be am refi your diet which is also very important ye hu say ye didie ni bebre asesa akoye
immune
enam ya ni fatty foods, a lot of processed processed foods, rice and nyema bebre, tin foods ne saa nyema no. But ye who say diet no also increases our risk when it comes to cancers. They would say that the protective ones no ebe say we be fruits ne vegetables ne bebre, because fruits ne vegetables no omo contain ade bi a your friend antioxidants.
And two the fruits ne vegetables so all the BOG vinegar.
Said they because ade no pa ade papa e wo mu na afrim. Pese yare foforo bi nso beka ho abata ho akonti wo de vinegar na ye ahohoro ho ama ho ate no. Na wonya antioxidants e wo fruits ne vegetables no. The antioxidants na ekoya ama wo ne say e ko fight against our cells ya niema ebe ma cells ne ho akoye den akotochima. Enti sa chemicals ne niema na meka ho asem na meka say ewura wo mu akọ destroy wo cells no. Se wonya antioxidants na eno no bekọ akọbọ wo cells ne ho ban. Said the beya be being cool run nipeduanum nenko say wo cells no nenko fa cancer ne nye den emma inti yenhwe ye diet nso ye and another thing so a very common stress. Stress no e can say stress adwuma mu stress stress pressure just any bebre stress, any stress bia no it can also stress
and
the
stress
cells.
They say my brain cancer.
Say yes, I dream no. Remember, say stress no. Enya adrenaline na ode dream no. But stress no, it releases certain hormones into your blood. Certain hormones like cortisol, hormones, they be a growth hormones, which will also stimulate the cells, cancer cells, to do what, to grow. Inte we see who say stress nya adrenaline no, and na ye dey dream say na cancer ni be pio. But generally no, certain hormones be a beba ye moje mu no. Ebe also ebe boa damaged cells, and I say ebe also increase your chances of developing the cancer. And also be all no develop cancer no banana immune system ni ye den shaso said ebe ya MP, but we are stressed that your immune system's ability to fight the cancer now comes down, and then now the cancer itself is able to show itself, and as it becomes overt into stress and so ya dia ye betimi ahwe na ya twe ye ho every moa and so be boa ye pa.
Kwadwa Sempa Furniture Works ewa adum or say this program is so special. Kwadwo ye da say 0551 599933 0551 444933. Pacho betimi afre na unso do question aba na ya answer ma. Hello, good afternoon. Hello. 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 Wafa.
What for what? The market is here information.
Of Obia we there.
Like, yes, I'm doing the mobile, but that's the and so much now boy match. Young people slow. Doctor, and we shall doctor take you new power with your money. Now the person this doctor said, they see cancer, I can watch me. They say, you are me for so what, and if you miss here, yeah. You go check up me for you. Then the show members who say, cancer, and the pattern of watching without.
A muda hopa.
Then the show, I'm not going to will be, and I make it, and I make it. All children who I say, go check up on Mamma. Why you have mentally?
Oh, why he ever call na cancer? You need a come doctor say, and said and die be beard.
Cancer no it depending on the type of cancer. Cancer bia ne symptoms a obenya. Inti emfa ne say breast cancer obehu se bibia beda wo no funu te sa aba. Obehu se bia wo no funu ba bi ye wo ya.
Doctor emfa calls ni bi enka ho. Hello, good afternoon. Hello.
Hello. Yeah, hello.
But I first and I can say free.
Actually, from is Clara. I'm a Kasafi Bolga.
Clara and Patrick too.
Yeah, I want to make some inquiries as to whether you can walk into their facility to seek services apart from being referred.
Okay, also you say you're calling from Bolga, right?
Yes, please.
Henti Bolga then obetimi aye.
So it depends on the person okoye. So is she going for screening? Inti emfa ne say person okome ye hwehwe ne no fu mu a eno no hospital bi e ben wo Bolga ho bia obetimi akọ ho.
Okay.
say cervical cancer into opese bia or kokoye pap smear or Bolga hospital ho no betimi akohu gynecologist no say bia me pese me ye pap smear ti say if I'm at risk of developing cervical cancer na HPV no kra me will be anase me ni bia and also say gynecologist no wo ho no ontumi nya obetimi a refer na ko baby a ye be ye pap smear na ma no and na papa ba ko ne question no cancer bia
Clara, are you okay?
Yes, please.
Okay,
Thank you.
thank you. Yento as the doctor.
Enti cancer bia won a symptom a yede bepi. Enti say ye breast cancer say me kan obi hu se bibi down no fom. Wo no fo ne ye oya. E bia won hu se ba kwa ye kesesin ba ko skin changes, color na sesa. Aye say bia ehun na ye te se anka. Wo hu se draw bia ba be show motum. Those are the things a obi hu. Say ye cervical cancer obi hu se nsuo bia hyate egume. E bia enka kakra wom. Ase me ni me kun hye mu wi a me hu moja. Eni se nka yesa. Ti cancer bia ne ne symptoms say about prostate mema cancer e bia bon say dia wo dwonso no ka first ukọ dwonso a ni nyina ba say wo dwonso a je se wo chim ansa na dwonso na ba wo be dwonso ewi ase ebia kem kakra kem bi o ha wo bon se wo be dwonso no se dia nka ba tin no e ba na etwa te se pipe e pese e bia etwa na waso ne foforo no aha sansem ni bi wo ama wo se.
Good afternoon, madam.
Pacha Frost and Alcasa free.
Pacha FM Dana, make us a free break room.
Okay, Pacha, it's you.
I'm a patrol, as my dog weekend. I said, yes, and some I said, Joanna, almost when I was a child, and I'm a moose, I don't know. I've been seeing a young around over 41 years. But you believe who says a kind of cancer in Indiana.
All right. Inti yema sisi ye hu de bebre, but what will let them know whether it's a cancer or not is say omube yi saade no. Ye dia akwa she fidie na se. Efidie no betimi a che say we cancer, we benign and I say enye cancer. But sometimes the danger is that ade bi wo ho na enye cancer from the start. But the moment etna ho for a long time na adani a changing into ebeka say it undergoes malignant transformation. Into first na enye cancer but are transforming ho. Into to prevent that risk no we make sure say when hu bibi wo ho eni se ewo ho a ko doctor ho na doctor nhwe abnormal growth bia no corner doctor if say enye bibia sometimes you try photo ne san e man kwa etumi try said this one the risk of it being cancer is so low. This is not a cancer, this one is just benign. Into that one you can leave it or you can even obi or horse still me dem pese me hu say wo me ho into munyim free ho.
Hello, good afternoon.
Pacha Frost and Alcasa free.
Me Bernard. You come as
Brad Ben, dan who ka crabby my why?
me pacho me no.
Pacha, it's you.
Where there doctor kind of me continue. Now who are for like I laugh. They see what they and yeah, you know wanted if yeah cancer.
Doctor, be you.
So just as I said, no, who as an individual, when you mean say a bia, into me the mistress say when who be bia or honam and now ni pedua no ma wo feel say you want to seek an opinion. Every hospital is available
for that.
Just walk in. Doctor, me hu ade we e bia minim say na as first say na net afi me hu say ye kese first na enye me ya but many ama so afi na ma adwen aba so just ko na ye hwe na say bibi wo ho e wo say ye fa ho ma wa because sometimes as I said cancer more nka ye but ube hu say bedu baby no na spread it dada.
Hello. Good afternoon.
Good afternoon.
Pacha Frost and Alcasa free.
Pacha FM ya. Me kasa free. Me pacho. Me pacho me pesa. Me bisa doctor. Adidi we me asu me pesa. Me bisa say dia me pesa.
Say won him Pacho.
Masi pa.
Side.
Me pacho.
What ma yate open?
Baby.
Okay. Ɔsi bibi esi sɛbi na simu.
A
The
difficult
entire mi bisa say I na pisi open. Ọmọ ẹyẹ ọmọ pisi o say ya na baby e stitch no ya na be
na ehọ na twitwe mpo abiti wo say na ehye ho kito ebi say na make say sometimes so ebi kra obi a wawo several times it me ye awode no na pushi abehye ho kakra ana adwo nso twa no na sometimes it me pushi bi a ebeka say cystocele and I say ebi kra urethral prolapse and I say ebi uterus no kra a prolapse all these things say me ne wo ka say kra no kra me ntimi hu say eye bibi a eye ebetimi aye cancer na ntimi nye cancer
e nyina age afidie no
nyina wakọ ma doctor aye den ahwe
Hello,
good
afternoon.
But I first say na o ka say free.
But your friend George, me can say free wager.
Ba George, wager for when you there.
But on your doing.
It's you.
Mpacho mpese mbisa doctor say
George, low
papa be yare prostate cancer. Obe yare prostate cancer no. Oh. Hello.
Pacho yetio, shasie.
Yare prostate cancer no omusi ombe no operation.
Prostate cancer no pacho yetio.
Me papa. Obe yare prostate cancer. Nti omusi ombe no operation na madam for bi ka kire mi say ye no operation obewu. Na me business adan o say obi nya prostate cancer na ye no operation owu. Ampa omu ye no operation and 1 year no di car baby. Na me hu oluma bi nso no so owo bi. O si obi ka kire ni say so ye prostate operation obewu nti up to now no new operation ti ase. Nti ampa say wo prostate cancer na wo operation owu ana.
Me so me uncle bi aye before be 4 years ni onwu ye. Me fan say in-law like my sister bikunu and so aye bi onu so the same be 4 or 5 years no onu so onwu yi. What I say? We na no ma me.
Ba so bibia ni ho e kire say ukoye operation a mubewu and as unya prostate ukoye operation a obewu and it's the same thing for breast. There are lots of people mka say na ye twa no for anache say ubewu enti enu nti kwa ma nipa bebre de omo cancer ti fi a onfa nkoma ye hwe bibia ni ho sa me meje di say ebia ene BBC ye any owuo ni be share sometimes it might just be speculative because there was something else and not the cancer because we have so many of our patients especially prostate cancer one of the very slow growing tumors and to say be onipa ne ba at a stage and spread obetimi aba beje ni treatment for all you know obewu a stroke hypertension and diabetes ne bekuno not the cancer per se. But people may speculate and say, oh, ebi a operation na ye koye no na nu echi na wanya hoden da. But it might just be a speculation.
Hello, good afternoon.
Hello.
But I first and I say free.
But so because if you are going to say do that, with the fee.
Fee it you.
But so but the doctor say me no so pa na me dun so be you am to no be o ta mo be 10 and 12 by by am me dun so say me no so nsa kakra na ma kodum so kakra na ma ko person bi san say
but when em face
problem but I'm 42 years.
Okay doctor you na no mama
First of all drinking a lot of water and bone in certain instances say in sukwamode na onu munsuo is good you will clear your kidneys once onu munsuo na obedun so bebre because insuo will have to come out and it will come out as urine inti obia onu munsuo bebre the more water you drink the more you urinate but the problem is that there are certain medical conditions in so ema wo no munsuo bebre ebini for example diabetes is one of the symptoms so obinya diabetes onu munsuo bebre than normal or jonso bebre than normal. So sitting here, no, I cannot say for a fact to say it is normal for you to drink so much water and urinate so many times in a day. It could be say a normal. If say with blood sugar a normal, like, it could just be normal. But what I would advise is that you can go to any nearby hospital. Let them just check your blood sugar for you. If your blood sugar turns out to be normal, then it's not likely that you have diabetes.
In
Then
a way,
it's just then in other words, it's good for you to drink water. But you see, the woman definitely a Johnson and Oben Johnson. See, the more water, the more urine. But to
Okay.
be careful, just know your blood sugar level so that you can be sure that you don't have diabetes.
Hello, good afternoon.
I design.
Yami Adam.
But I can't be a family.
Pacho,
Me better be Mr. Doctor. Me said, oh yeah, prostrate operation. Oh yeah, Burma. What is it? One at the day.
also yeah, prostate surgery ni we are ahoden da
So
so
no
wa na.
prostrate. And na me say, oh yeah, operation. Oh yeah, Burma. What to me? I had to be an answer one of.
Okay, nti operation bia wo koye a ye ma wo sign consent form. Na ye ka emu asem ebetumi asi. Ana se niema a operation ebetumi di aba. Se bia ye operation ye niema bi betumi asi. We hu betumi atochima, moja betumi atu. In the west kra no anesthesia ne betumi anam so ama wo efeli ama wewu. So there will always be those things. One of the things omube list actual ne say you can have what we call neuronal damage. And I say nerves no supply or penis no might cause erection, and as if vessels na no there can be a damage to it. It doesn't mean say 100% say okay operation ABC, but it is a risk which can happen. And
but does it normally happen?
It's not common.
Okay.
But if it does happen,
yes,
but if but the doctor and your operation or natural. Because me crowd me be ma okimwa me ma wo sign the consent for make catch say kimo na betimi ama oti ho atutu. What you say? Metimi catch say ubeye say besi. You will have to know because a man can't you know who later. I've not done the right thing. I've deceived you. And of course, a bit me damaging nerves na e dey call or penis ne ho ama wenya erection no. Which means say bibi touch ma wo ho during the operation dia. You be reoperation, you will have some form of erectile dysfunction. But it will depend on the degree of damage. Sometimes it might just be mild. You might have mild dysfunction. Sometimes it can be very severe to the extent that you might not have erection at all. Okay. But those happen in very few cases. But it's a possibility.
Now, how be anyone? Hello, good afternoon.
Good afternoon, madam. Pacho me dia je so me free oboasi.
Pacho etio.
Pacho my wife. Pacho no banana na se no atata omiem se mia na to.
Pacho
abane. Onyem.
Pacho onyem fie sen.
O 70.
Pacho pressure.
Our pressure.
Na esi chire nso e.
Esi chire de oni.
Okay, Doctor be you and Doctor Enko.
Na setata no nkoa might not necessarily be a symptom of cancer. Yeah. It can be a symptom of any other disease. For example, ABA. Say when you're a pitting, the pitting edema, which can occur when there's a problem with the heart. Na kuma. It's a bit me I say maybe she's in some form of heart failure. For which reason it was also called hospital. Because akumano air pumping mojan say who ba assembly into me in juma in sio better nasi. It was all called especially because she's hypertensive and there's that risk na kuma no who bet me have a problem. Okay. The same way with kidneys. Say with kidney de in sio ni pia bontene so who ba problem e bet me ama in sio atata nasi. And because of our pressure, which is a risk for kidney failure or kidney disease, no, it was so come here in the kidneys. No. The same way it could be from the liver. The liver, no, so one of the organs. It was in the hospital. It was all called intensive. Yeah, no more share baby a problem ni fiber. No more to me tackle man before it be too late.
Hello, good afternoon.
Afternoon.
But your frost and I free.
But your man
Manton kayo.
Pacho if man
Okay, rap on say too.
Pacho the machine you make me.
Mission so utie.
Me so me didi anopa. Na no jam da suka. And digesting yeah. The janana da all the baby
Ukuta machine a wode hwe wo minimum hu se adwane na digest. Ramponsa.
Last time. And you make a go on my medicine before you.
Okay, doctor, because also problem with digestion.
See, digestive issues. I'm believing said your person always been say, "Oh, you bloated."
Maybe he takes too much.
So it can be so many things. It could actually be a problem with the digestive system, no, which might be medical. Into there are so many conditions. It could just be an irritable bowel syndrome. What we call that, or maybe he has problem like dyspepsia, he has problems with digestion and all that. It could be from any of the organs along the digestive tract. It's in some cases there are some cancers that appear with just bloating. Be or why just bloated, be why constipated. Colon cancer, they are kind of colon cancer, and it's a cancer if we have large intestines no colon no can sometimes present as bloating and constipation, but sometimes if you have moja kakra or toilets. Some people might not see that, but those two, bloating and constipation, are one of the common, like two of the common symptoms that you see. But seni American, ni na be trase udi be my doctor ashishim, because I cannot tell you sitting here say, oh, because when you're bloating, cancer. Remember, say cancer is a histological diagnosis. You can only make the diagnosis of a cancer when you've seen it under the microscope.
Okay.
There are few cancers imaging ultra CT scanner, you say that this is classical, this is a classical case of this. But even then there are some cases who CT scans where you say, oh, this one is this type of cancer. Lab no a different type.
There's a microscope in the cancer.
Exactly. Pathologists are very key to the diagnosis.
Hello, good afternoon.
Good afternoon, madam.
But I first and I can say free.
But the family could you have that's free.
A day boy, I say, be over twice. I'm so already, no, free home. What?
I TV no.
Any empacho free, no, honey, any common for phone.
I know, fine. Okay.
And it's okay, only a doom no.
No, doom.
That's sympacho any common.
If you feel one, we're starting, I'm a fair more time. Because I'm a doctor, say. You do baby, I'm an auntie, and I'm a name of free. In free. Sometimes.
Age, come home. Age, a determinant.
Okay.
But when you feel say,
I'm 50.
But your doctor, you are.
And see, I think that most people, I mean, who say most people don't have. Don't sweat in their feet and even in their palms. But your own phobia, time be hanky crashing in some or paper in some. And it's just because you have a lot of sweat glands on your palms and your feet.
Any negative
It's just that the positioning of the glands are more on your palms and your feet, so automatically you will sweat. But what the American say, obi wo hwa ono the density of sweat glands baby skin, wherever there's skin there are sweat glands, but obi wo hwa the sweat glands are more concentrated at particular places. See ebia obi hu say bia ne face has a lot of sweat glands. In time bia na nanimu ye den 1850 obi wo hwa ne axilla na motuom hu say time bia na motuom afọ itumi fọ na tade obi wo hwa so on sweaty so much even in the axilla. Obi wo hwa say bi ne nufu ase ana ne groin no. It depends on where you have a lot of concentration of sweat glands. Intimini ni say we sweaty wo na mu ne de boni bia.
Good afternoon.
But I frost and now can say free.
So I'm free and do a friend man.
And to one side too.
But me back it what I am so in the neck. I will want a bench so na free and back in so me be na
O se ensa sisi ne kon ho.
Baako po oti wosan wosɔne na me hu ye. Ɛwɔ hɔ a na wɔtim. Na ɛtim so afei later.
Tuma sana na ko hospital.
Mede ne kɔ no mo ma me tu bi sɛ me mfa to. But ɛnyɛ ne yɛ. Chanta me mia mo den enso kete sɛ enso ankasa.
Kete mampole. Doctor.
Auntie Mansa, me jidi say this also had in ko because say wako doctor hona wa ma wedru say wo say ke esayare no na still like that so wa.
Doctor treating external. Also man tube bi so on
okay, on fine so. So sometimes
rash,
you will have to go back. Maybe an on sign share on review the other no sometimes you would have to add something else to it. Inti me kase nka wo de ne san ko back bi mu a enka beboa. No mo ahwe hu adekode airport ya yes why
example the calls no ebesi ha a community miensa na ya sorry na commentary ene de eto aso wo TV so aba e de amaye eno nti baby edro ne ntimi mfa calls bio em say questions ne mudodo na na doctor answer de amaye nti na obi bisa o kan diet asem say you need more fruits and vegetables in a nutshell bed day ya boy ho ban under 1 minute African says
okay see what I would say
executive summary
what I would say is that say the cancer no yare a aba say aye quite ye ka say aye common and as first na ye nti ho asem bebre ba say because of nimde ne nyema aba ne de etumi ye nti no ama ye bo hu de roma nipa eba me etumi ehwe wo mo but said the aya kan nyema bebre a ye betumi aye de abo ye ho ban titiw no kan say ye betwe ye ho afri nyema bi te say smoking alcohol you be say you be exercise very well you be reduce your stress levels na you be did ye and I say you be share your diet ye eat a lot of fruits and vegetables any you be reduce processed foods any fats and nam bebre no sa nyema we no ye ya etumi boa yen protect yen na nyema bi wo ho nso a ye betumi aye any say for example radiation ya meka ho asemi no de bia meka say difficult for nipa na okọ no ode yare na ko ba nye bibia na bia wo say ye twa x-ray nye bibia na wo say ye twa CT scan sometimes doctor ne be hwe na we hu ko patient bi oh doctor ade na wo me nye we ade na wo man but sometimes doctor ne nim de ntia or full say ye a less invasive procedure ebe protect because all these things are going to expose you afen so ye nwuma ye mu ye nwuma die mu ye nhwe se ye be reduce the risk of chemical carcinogens say adwuma wo ye no wo de wonsa anasa wo de wonan ye bibi ana wo humi bibi ekomu a wonim se betumi damage wa always try to wear protective clothing and protective gear ebe protect you because unko ye adwuma nko peska na won san fa sika kro na anye den ensan fa nkosa inti no de meka akusie no
yada say Dr. Adwoa Sare doctor oncologist oni e ne sha ase a wachiremu ama ye hu said the oncologist na adwuma te ene said the ne niema nso so etimi etie happy birthday enkoma Mr. Joseph Opoku Menu US of A ye ma happy birthday we free wife Mrs. Henrietta Opoku Menu Right Care Pharmacy was Obolo ena ode ma yeda ma se samoje bre na mo hwe ye na mo tie stay healthy yeda doctor say so no so nya bre ene abedi nkomo yeda BOG vinegar multi credit savings and loans limited so we discuss soya sene ema etimi betena ase ene obedi wa pomoden eho enkomo aseda kese enkomo production team headed by Mr. Samuel Edujemfi Ezekiel ene chinchim fidie ne de mayen camera Isaac Ansu Agaza de eko Facebook ene YouTube na me shraw me din de Adwoa Chirewa dada Tony the commentary eba ama 92.9 and 93.3 Kessben TV ye woni pa bebre e de maw na me shraw na wo twe se ne ye besan